Hello, we're back for another episode of Pawwfice Hours with me. So today we decided to talk about post-op dental procedures and what our recommendations are and why. So I grabbed this thing. I don't know if you guys can see this a little bit, but this is a map of the dog's mouth. We use the cat's mouth on the other side. This is just something that we use to keep track of what teeth are missing, what teeth are abscessed, what's going on with the teeth mid-procedure, and then this gets transferred to their record in the computer. I mention this because this is important to know, like, this has a lot to do with what our instructions are. So the few main points that we typically talk about with discharges, especially from dental procedures, is what to expect after anesthesia, what's normal, what's not normal with recovery, how long it should last, pain relief. As I think you can imagine, having teeth extracted is can be painful. Anybody who's had dental work knows that it's painful. So what the expectations are with pain relief, and then how we're feeding them is also super duper important. So after anesthesia, typically that first night after anesthesia, your dog or cat will be sleepy. Some will be a little restless, even whiny that first night. I always tell people the better they sleep, the better they feel when they wake up. It's the animals that are fighting to wake up from the anesthesia that really just don't do well. They're vocal, they're uncomfortable, they're stressed. So alleviating that as much as possible helps them. That's actually one of the reasons why we send them home to you, is because they are more relaxed at home. They have their own place to sleep, so they tend to do better that way with the recovery. Typically by the next morning, in some of our older patients, maybe 2 days later, they should be basically back to their normal selves. But they should have no problem getting up to go outside, to walk around, to go to the bathroom. They should be interactive. They should, be responsive to you. And as time goes on, becoming more and more awake and more normal. Pain relief. So when they are here, we're giving them multiple different medications to help with pain relief. So the combination of medications they get before anesthesia, during anesthesia, are very good pain relief medications. We do local nerve blocks around their mouth depending on what teeth we're extracting. So that's basically the same thing that happens when we're having dental work done. And you feel like, like your lip is all fat and stuff. But they don't complain about that we know of. So that is happening. And that typically will last about 6 hours after the procedure. And then usually they're going home with an anti-inflammatory and pain relief that you give orally. So it's important. Sometimes what happens is when you're not able to give this oral pain relief, the dog or the cat then becomes painful, then they don't want to eat, they're not drinking, and that is often when we don't see a good recovery. So if you're having difficulty administering that oral pain relief, we do need to know that right away, because we don't want to lose that pain coverage and then them having develop other symptoms. Sometimes they need a different formula, like a liquid versus a tablet. Sometimes they need a different combination just to give them better relief. So that's super important. The mouth is very forgiving. It heals very quickly, which is nice when we're recovering from a dental procedure. However, when they've had extractions, and they typically will have stitches in their mouth, and feeding them soft food is going to be very important, because even though the mouth heals pretty quickly, anything they can chew on hard, crunchy, can open up those stitches, and then we have even a bigger mess. So that's why feeding them soft food. Often I will recommend, instead of doing a diet change, like softening their kibble by letting it soak in water, or a mixture of water and like chicken broth. You do have to let it soak for quite a while in order to really soften that kibble. but some animals will do better with that rather than a complete diet change. And we typically recommend that depending on how many extractions your pet has had, for about 2 weeks. And then typically by the end of that 2 weeks, most of the time we get them back in just so I can take a look and make sure everything's healing like it should. Then they can go back to normal. We also send them home with a cone, and I know everybody hates the cone, but I'm going to tell you, when we made it more optional, we had more post-op complications. And what that looks like is they are able to rub at their mouth, paw at their mouth, open up any extraction sites. And then the only way to fix that is by putting them back under anesthesia. So we are having less complications by basically not giving you a choice, but to go home with the cone. So even though that's super annoying, it is really important. Talking about this, because we've been doing quite a few dental procedures, I personally think we talk a lot about dental care, oral care. There's been so many advances and improvement with how we take care of a dog's mouth, how we can do it more safely even for these older animals, and how we can keep them just more comfortable throughout the procedure. So because dogs and cats, they do a terrible job showing us that they have dental disease and how painful it is. So we really can't rely on them. We really have to be in there looking at the mouth, noticing very small changes. Yeah, I think that's about covers it. So if you're concerned, like if you're like, oh my gosh, my dog's mouth has a weird new stink to it, if you notice some red gums, maybe drooling, maybe they're not playing with their toys as much, those can be very subtle signs that something's going on. Definitely let us know. I think it's also important that we talk about the cost. I don't want to pretend like this is not a costly procedure, because it's surgery and it definitely is. However, let us know, because there's often things we can do to help you manage that cost, either on the procedural end or payment end, that we can do what your pet needs and help you guys in the process as well. So just, let us know that. We really want to be able to be upfront with us about that, so then we can have a discussion about what's going to be best for everybody. And we're going to call that a day today.